We will discuss about eosinophilic esophagitis. EOE. Okay. In order to address in a short form, I will be using EOE. Eosinophilic esophagitis. Basically, it is an chronic allergic immune disorder. Okay, so the word eosinophilic itself points you towards allergic or immune disorder of the esophagus. Okay, which part of esophagus? Most all the parts. It involves distal, mid and proximal. All parts of the esophagus are involved. So eosinophilic esophagitis is most commonly seen in children's. I will tell you why it is common in children and pre-adolescents in the coming slides, and also common in adults of age group 30 to 40. Okay, early adolescent adults. So what leads to allergic or immune disorder? What are the triggering points or trigger factor is this? The triggering factor is food allergy. Food acts as a triggering factor for the development of allergic reactions. Introduction of new foods, especially in the children's or the newborns, also can lead to the development of eosinophilic esophagitis. So once these new foods are introduced, they develop the allergic reaction. They present with vomiting, pain, epigastric pain, nausea, weight loss, dysphagia, dyspepsia. So these are the symptoms they would present with. So the pathology behind the background behind this allergic reaction is the role of TSLP. So what is it? It's something that is related to a gene. It's called as thymic stromal lymphoprotein. It's located in gene Y. 11.3 in the chromosome 11.3, and there is also a role of eotoxin 3. Okay, so basically this thymic stromal lymphoprotein is the reason behind other associated allergic disorders such as asthma, bronchial asthma, atopic dermatitis, etc. So they play a key role in allergic disorders. So as you all know, this thymus gland is most active during your neonates the neonatal period and pre-adolescent. So this is the reason behind the incidence of eosinophilic esophagitis being more common in the pre-adolescent age groups and the early adult age groups people. So they basically present with dysphagia, dyspepsia, vomiting, pain and nausea, weight loss, etc. So once they present with this, initially we treat the patient with thinking it is of a GERD or esophagitis. Initial treatment is with proton pump inhibitors for a period of 6 to 8 weeks. If this patient's peripheral smear shows eosinophilia and they respond to PPI, then this is not a case of eosinophilic esophagitis, because they don't respond. They will never respond to your PPI. It is a important criteria for your diagnosis of eosinophilic esophagitis, that not responding to PPI, that too for a duration of around 6 to 8 weeks. They won't respond. If they respond, it is called as PPI responsive eosinophilia. What is it? And that is a relative term used for that condition. So moving on, at arriving your diagnosis, so there is two criteria. One I have told, not responsive to PPI therapy for 6 to 8 weeks. Plus I have told you, I'll show the picture slide, it's P slide afterwards. Biopsy, endoscopic biopsy, you must demonstrate the eosinophilic infiltration of minimum of 15 per high power per field. So these two criteria must satisfy before you diagnose a case of eosinophilic esophagitis. So when you do a UGISCOPI, you will find this rings or narrow bands, what you called as trachelization of esophagus. These are all MCQ points that has been asked previously for you. So in barium, that is to double contrast, you can appreciate it. The concentric circumferential rings that is being formed, which is also called as feline esophagus, that resembles that of feline. The species Felidae resembles to that of a cat species, so which has a resemblance to that of the barium finding of your eosinophilic esophagitis, hence the term given feline esophagus. All these have been asked in your previous exams. So remember all these terms: feline esophagus, trachelization of esophagus, all these have been asked previously in your exams, and a minimum of 15 high power field of eosinophilic infiltration has to be demonstrated. And what is the minimum biopsy you must take from the field is the biopsy should be 4 to 5. Minimum 4 to 5 quadrant biopsy should be taken. And after this biopsy, so how you are going to treat the patient? So for any allergic condition or allergic disorder, the best treatment would be elimination of the allergen, that is your source. So what is the source here? It is food. So if you try to avoid the allergic food for a minimum period of 6 to 10 weeks, all the symptoms, even the esophageal findings, tends to resolve within 6 weeks. So best treatment would be elimination of the allergens. Sometimes what are the complications may be on the danger side would be development of strictures. 15 millimeter can occur. Narrowing may be on a rarer side due to eosinophilic esophagitis can occur. So this is non-pharmacological treatment or non-medical therapy. What is your medical therapy or pharmacological therapy would be topical steroids. Is given using usually fluticasone is given. So but what is the problem with steroids is that once you stop steroids, then the symptoms will recur. The recurrence rate is as high as 50 to 70%. Plus, what is the other important side effects of using topical steroids is that it leads to development of oral candidiasis. So it's always better to advise your patients to wash your mouth after every spray of your topical steroids, and maintenance of good oral hygiene is very important. So there are some new drugs that has been proposed in the treatment targeting your, we have discussed the main key role in this is TSLP, okay, stromal lymphoprotein. So targeting that, an antibody has been developed and the name is tezolizumab, which inhibits this thymic stromal lymphoprotein. It's under upcoming trial, and it is also found to be useful in bronchial asthma and atopic dermatitis also. So this is a HPE pathological findings that you see in your slide microscope. So what are the findings that has been described here is that this arrow points, these arrows points towards the eosinophils. As I already told, this should be 15 per high power fields, more than 15 per high power fields, and These are also eosinophils seen both in the surfaces and the luminal parts also. This aspect represents the lamina propria with fibrosis and inflammation. And another important finding here that is demonstrated is there is intercellular dilatation. Intercellular dilatation sign, and sometimes subepithelial fibrosis also occurs. This is the UGISCOPIC finding with multiple whitish patches because of the micro abscesses. Okay, on the danger side there may be a complication of stricture also, although rare. It can occur due to eosinophilic esophagitis, and you can very well appreciate this trachelization, concentric circumferential folds, which we called as trachelization of esophagus, or in the barium swallow we called as feline esophagus. So this is what I want to discuss about this eosinophilic esophagitis, and you have to remember all these things, and this is already an important topic, and it has been asked in your previous exams. And what I wanted to tell is that it is most common in children, and it is a male is to female ratio is 3:1, which means it is most common in male, and it's a male predominant disease. Usually the autoimmune disorders or the immune disorders is most commonly common in females. This is another disorder which is more common in males, and you have to remember it, and henceforth you get so many questions from this topic. Thank you.